more about your role in all of that. And I was saying earlier that my story takes a while to tell, and sometimes I think, okay, well, we have to talk about this other stuff. Is that really necessary? You know, should I spend so much time on that? But the thing is that everything I'm about to say you could probably read in a book, but you can't get the walking with the parent through the journey a different way. So that part is important, to get the perspective of the parent, because for you, maybe some of this is commonplace. You're dealing with it every day, but it isn't for them. And you are such an essential part. You are the key to making a difference. If my babies were born right now, they would not be able to cry. That seemed like the most horrible thing I could ever imagine. To not be rewarded with the joy of hearing the sound of my baby's cry after a long labor. I talked to the caring nurses and prayed in between the bouts of sickness and the pains. Whenever I became ill, the nurses ran in, held my hair back, and touched my head with a cool cloth. Sometimes I even pushed them away. I didn't want them to see me like that. But they always came back, persistently caring, willing to walk with me through the dark valleys, willing to look upon the things that are difficult and ugly, willing to hold my hand when I was afraid. They would say they were just doing their job. They're nurses, that's what they do. I would say that we all have a choice when life gets difficult and someone is suffering, to look away or to show compassion. I'm sure there are times when it would be easier to look away. It takes courage to show compassion, to look into the eyes of pain and suffering and offer more than a solution, but to offer something of far greater value, the willingness to walk the journey with the one who is suffering, to care even when it hurts. Dr. Marcotte's courage to show compassion in the midst of our suffering surpasses any I have ever experienced. It must be one of the most difficult things for a doctor or caregiver who is in the business of healing to have to say, "There's nothing I can do." No one could blame you for turning off the emotions when it gets too painful. To some extent, I can see how that might be necessary. I can see how one would eventually put up a wall of indifference in order to cope with the demands faced by medical professionals. But this man did not put up a wall. He courageously walked this journey with me every step of the way. In such a tender time, positive, affirming, and gentle, non-judgmental attitudes and words are needed. Again, this goes back, and I will probably say it several times, your grief style may not be the same as the people that your patients. And it may be hard sometimes. You might think, well, they're not doing it right. They're doing it, they're walking their own path. And just because they don't react the same way at that moment doesn't mean that they're not doing it right. There's no right or wrong way. Your influence means a lot to that family. I cannot express enough to you how shocking it is to hear your baby has died. That is not supposed to happen, and no one can prepare for it. In fact, it is so impossible to process that it's often not until much later that a parent even fully realizes the magnitude of what has just occurred. That is why your role as a doctor, nurse, or caregiver of any kind in guiding parents through this process is so essential. The caregiver has the unique position of bearing the hardest news a parent will ever hear, as many of you know. I don't envy you for that position. Shocked parents look to hospital staff to guide them through this process as a source of information and maybe even as a place for encouragement and comfort. You are going to be the one with a clear mind. You are the one who knows what's out there. They are not prepared. They are not walking in. Most of the time, they are not walking in with all of the information. So we want to give it to you so that you have it. And even if they did have all of the information, they are not in the state of mind to remember everything that they might want, to even know what they might want. And there's just this tiny window of opportunity. And there are things that they may regret forever if they don't get to do. So that's why it is so important for the staff to know what's out there, what resources are there, because you can help them through that process. You can be the one offering the information and guiding.